Hello, everyone. This is Mandy Solacek here from Premier Marketing. Thank you for attending today and joining us so that we can chat a little bit further about GTL's newest short-term care product that hit the market this year, which is Home Care Secure. We always enjoy having the people of Home Care Genie here to discuss this with us. So we've got Nick and Liz here who are going to chat with us more about Home Care Secure. Oh, yep, there's their pictures up on here too. But first, before I hand it off to them, we do a short question and answer at the end of our presentations. So in your webinar feature here, in the GoToWebinar, you will see a little box that is for questions. So please feel free to input any questions you may have about the product that you would like Nick and Liz to answer, and we will be happy to go through those. Also today, we have a little prize that I'm going to draw amongst our attendees today and send out to them as a little thank you for attending the webinar and sticking through it to the end with us. So at the end of the webinar, if you're still hanging out with us, I'm going to go through and draw a name, and we will be getting your contact information so we can send a little gift out to you for being with us today. So with that said, Nick, Liz, I'm going to hand it off to you guys.
Excellent. Well, everyone, good morning, and thanks so much for the warm introductions. As Mandy had mentioned, my name is Liz Christopher, and I am joined by my colleague Nick Polish and Tierney Beauregard. And we are thrilled to be with you today to introduce an innovative solution which combines insurance with navigation and advocacy resources. Now, you don't often associate insurance with innovation, but after today's session, we hope you come away with just that, a different way to think about insurance and a robust offering to enable your clients to realize their dream of aging at home as safely, as independently, and as long as possible. Now, before we get into the product details, we did want to provide you just with a little bit of background as to why we designed this solution. So all of our employees at Home Care Genie have either been a caregiver or have had to search for caregiver services, either for a family member or a loved one, as I'm sure many of you and many of your clients have had to do as well. We know the majority of people want to age at home now more so than ever, yet the emotional and the financial burdens can be overwhelming, both to the individual and to the loved one. In addition, the home care system is disjointed and fragmented, especially within the short-term and long-term care spaces. And if you couple that with the misunderstandings and misperceptions of what Medicare will cover, it's no wonder that there's a problem. So did you know that the average person will consume roughly $50,000 in unreimbursed custodial healthcare expenses in their lifetime, most of which is not budgeted or planned for? So it's a massive blind spot for so many, one which results in not only having to make difficult decisions from where a loved one ages, but also to the quality, to the access, and to the type of care that they may receive. And on a very somber note, these expenditures are the primary reason that individuals file for bankruptcy late in life. And so that's what brings us to Home Care Secure, which is our integrated solution, which combines an indemnity insurance product with navigational and advocacy supports to provide your clients with the tools, the resources, and the financial security to age at home. Now, at a very high level, the indemnity insurance product has available lifetime maximums ranging from $20,000 to $60,000 in $10,000 increments. The benefit's designed to pay over 50 weeks, thus leading to weekly payments ranging from $400 to about $1,200. And because of the indemnity nature of the product, the money is paid directly to your client. Now, if you move over to the right-hand side, you will see the Aging at Home Association. And this provides a robust set of tools, resources, and discounts that we've divided into three main areas. So one are discounts and special values for frequently used goods and services. Think of prescription drugs and vision care. The second category is care coordination services. And these we have a continuum of offerings that range from online self-service tools to help you make a plan to age at place, up to discounted personalized services by a dedicated advocate who's trained in elder care. And lastly, we offer an annual well-being assessment that we developed in partnership with Fidelity Investments and the Stanford University Center for Aging that takes a holistic view of an individual in the areas of life, health, and money. So these elements work together to educate your clients on the emotional, the social, the financial, and the operational components to be able to age at home. Now, before we take a deeper dive on the product, I did want to share results from some preliminary market research that we had conducted with one of the nation's largest retiree exchanges. So this chart illustrates that respondents placed an equal value on the association benefits of support, planning, and discounts on par with that of the cash indemnity benefit. So this reinforced our hypothesis that Home Care Secure and the Aging at Home Association are highly valued on an individual basis. However, when you combine them, they represent a very powerful and market differentiating solution. And with that, I'm going to turn it over to Nick so we can dig into the details on the product.
Great, thank you, Liz, and hello, everyone. So I'm going to spend a couple of minutes on this slide addressing the three questions that are likely top of mind of all of you. First off, how do I qualify my clients? What are the key product features, and how do they qualify for the weekly cash payments? So let's work our way left to right. So from an eligibility requirement perspective, there are simply two. First, your client must be entry age 35 through 84, and then secondly, be able to pass the 5-question simplified underwriting process. And passing is the ability to answer no to each of the health-related questions. And you'll see in a few minutes that our questions are very narrowly scoped. And based on our experiences, 90% or more of your clients will be able to pass. Now, from a key product feature in the center column, similar to other products in this category, Home Care Secure utilizes entry age pricing and is guaranteed renewable. So let me give you an example. So a male who purchases a $60,000 policy with the inflation rider, if they purchase that policy at age 50, the monthly premiums are $72. If they purchase the policy at age 60, the premiums are $107. And by age 80, both of those individuals, if you will, would have paid $26,000 in premium. But the person who purchased it at age 50 would have had 10 years of additional coverage. And then beyond age 80, the cost would be less for the individual who purchased the policy earlier. So it just gives you some perspective on the power of purchasing as early as possible. Now, to have the policy keep pace with wage inflation, we have two mutually exclusive options built into the program. First is the inflation protection rider. Second is the $10,000 buy-up. So let me just cover the key components of each. First, the inflation protection rider. So that's a purchase decision that your client would make at policy issue. It could only be added when the policy is first issued. The interest rate is 3% simple, beginning in the 7th policy year. And it's important to note that there's no limit to the increase in the lifetime maximum while the policy is in force. So for example, someone who purchased a $50,000 lifetime policy with the inflation rider, after 30 years, that maximum will have grown to $86,000. Now let's contrast that with a $10,000 buyout. So this is available to someone who elected not to purchase the inflation protection rider at policy inception. And the buy-up is available to them every 3 years or more. However, it's subject to a lifetime benefit maximum of $60,000. So to continue with the example I used on the inflation rider, that individual with a $50,000 lifetime maximum benefit would only be able to buy up one time because then they'll be at the $60,000 cap. Now, the lifetime maximum benefit grades over a 5-year period. Starts with 10% of the lifetime maximum benefit available in year 1, 20% in year 2, and then in the 6th and subsequent policy years, clients have full access to their lifetime maximum benefit. So what was the rationale behind offering this feature? Well, first, it allowed for the simplified underwriting process with a very low bar of entry, 90% or more acceptance. Secondly, competitive rates. And third, while none of us can predict our healthcare future, individuals generally purchase these type of policies 5 to 15 years or more before they anticipate needing the cash payments. And thus, in these situations, the grading schedule is effectively not applicable. So the last feature I'd like to share with you is the multi-episode of care. So the headline here is that Home Care Secure can be used episodically over a period of time for acute healthcare conditions. And one episode of care ends when the individual recovers and does not need home health care services for a minimum of just 30 days. Which then kind of leads to the next question, and I'm on the last column now. How does an episode of care begin? How does one qualify for the weekly cash payments? So there's 3 requirements. First, a licensed healthcare provider, and it's important to point out that while it can be a physician, it doesn't have to be. It could also be a registered nurse or a licensed social worker. But one of those healthcare professionals must certify that the individual suffers from either a physical or cognitive impairment. A physical impairment is the inability to perform 2 or more of the activities of daily living: eating, dressing, bathing, transferring. A cognitive impairment, for example, is a dementia diagnosis. So that's criteria 1. The second criteria is that your client needs home health care at least 3 times a week, and each visit is at least 1 hour in duration. And the third and final requirement is that all of this is documented in a plan of care. As Liz mentioned earlier, this is an indemnity benefit, so the cash payments are made directly to your client, and they have complete and total control over how they spend that money. Let's turn the slide and take a quick peek at the knockout questions. So these are the 5 questions that I referenced earlier, and while you're all skimming them, let me just leave you with some thoughts. The process is simple. It yields real-time determinations at the point of application, and it's easily attainable. Note that the questions are very narrowly scoped, and as I said earlier, based on our experiences, 90% or more of your clients will qualify. So with that, I'm going to turn it back over to Liz to talk a little bit about the benefits and services of the Aging at Home Association.
Great, thanks, Nick. So now that we reviewed the insurance component of the offering, we would like to focus on the advocacy and navigational supports. So as we highlighted, we were very purposeful in the design of both the product and the association. Since we've been in this position ourselves, either being a caregiver or having to seek or search for caregiver services, we know how overwhelming the process can be. And in addition, with our vast experience in the insurance industry, we've seen far too often that people don't learn about their insurance, right? They don't understand their benefits or have expectations around the coverage that they're entitled to until they're sick and at their most vulnerable. Thus, they're usually not equipped to make the best decisions. Therefore, we wanted to bring together the tools, the resources, and the navigational supports to help individuals and their caregivers in advance of their time of need, so they have increased peace of mind. Now, as many of you are aware, since Medicare does not cover expenses related to dental and vision, and even if an individual does have prescription drug coverage, huge gaps still exist. Therefore, we wanted to ensure that our association provided these valuable benefits and discounts. So just want to share a few examples with you just to give you a flavor of what we mean about the benefits and discounts within the association. So we offer free unlimited telehealth through MD Live. And one thing to keep in mind as we go through these, while these are benefits that are available to the insured, the association benefits can be utilized and taken advantage of by the insured's immediate family. So that means you can have free unlimited telehealth virtual visits for the whole family. In addition, they can experience discounts of up to 50% on dental and vision, and that's both hardware and services, and up to 85% on certain prescription brand name drugs through their prescription drug coverage. Now, all of these provide real value immediately to your clients, totaling on average about $500 a year in savings. One of the benefits, though, which is truly differentiating, involves our unique partnership with Wealthy, which provides concierge care coordination services. And Nick actually has a personal story on this front that he'd like to share.
Yeah, and my personal Wealthy story will likely resonate with many of you, as you either personally have gone through a similar situation or friends or clients. But so several years ago, my father passed away, and my mother made it very clear that her intentions were to continue to live in the home that she raised her family. But over time, she was becoming increasingly socially isolated. She was exhibiting memory loss and was clinically depressed. So something had to be done. But like many families, I lived several hundred miles away from where I grew up, and I had been out of the community for decades. And thankfully, I had Wealthy to turn to. I was paired with a care coordinator, and she holds a master's in social work with a focus on elder care. And we had a couple of phone calls where I brought her up to date on the situation and what we were trying to accomplish. And out of that, she created a holistic care coordination program that had three components to it. First was addressing the immediate need, and she identified resources in the local community to allow my mother to continue to safely live at home. Secondly, recognizing the trajectory of her health with the memory loss, she researched and vetted assisted living facilities and nursing homes in the area, and with a particular emphasis on those that had memory loss units. And then finally, from a financial perspective, she researched and identified a financial aid program run by the Veterans Administration, with which my mom was eligible because of my dad's military service. And so because of these efforts, my mother was able to live at home for an additional 2.5 years and is currently a very happy resident at one of the vetted assisted living facilities. And I often think about what would have happened if I didn't have Wealthy to lean on. And clearly would have been much anxiety and sleepless nights, would have made numerous mistakes. And at the end of the day, she would not have lived in her home as long as she did. So I hope this experience brings to life the value that Wealthy and its care coordination services can bring to your clients in their time of need.
Great, thanks, Nick. So with the insurance and the association, what does all of this mean? So let's meet Retiring Ray, which is a persona that we created to bring these elements together and make them real for you. So Ray purchased the $50,000 policy with the inflation rider when he was 65 at a monthly premium of $109.57. Now, we were very particular about selecting this level of coverage, for example, because if you recall earlier, I had mentioned that the averaged unreimbursed out-of-pocket custodial expenses are roughly $50,000. And this is an expense that 2/3 of us will encounter in our lifetime. Unfortunately, at the age of 80, Ray requires in-home custodial care and needs to go on claim. Now, by this point, Ray has made monthly payments in the amount of $19,700. Yet, if you look here, he has an available maximum benefit of $63,500, which reflects the original $50,000 policy plus the inflation rider, translating into payments of $1,270 every week for 50 weeks. And now, since Ray has been a client for 15 years, he's been taking his annual assessment, he's been leveraging the available tools and resources. Ray and his family have had these discussions, and they know what to expect from a benefit perspective. In addition, they have an aging at home plan in place, and now they're just executing on that plan, but with increased peace of mind. And so with that, I'll turn it back over to Nick to help close us out.
Great, thanks, Liz. So let's talk a little bit about home care secure market advantages. As we surveyed the landscape and compared home care secure to available alternatives, we identified 4 key areas of differentiation. First, product complexity. Let's talk about behavioral economics for a moment. Numerous studies over the years have all concluded the same thing. Too much choice leads to consumer confusion and reduced sales. So with that in mind, Home Care Secure is designed to be easy for clients to understand and easy for you to explain to them. There's literally just 2 decisions with 7 choice variables. What lifetime maximum do I want? There are 5 choices. Do I want the inflation protection rider? Yes or no. Other solutions on the market require up to 7 separate decisions and in excess of 60 choice variables. Secondly, the underwriting process. With Home Care Secure, it's simple, immediate determination at the point of application, high acceptance rates. Contrast that with other policies in the market that require both knockout questions and/or medical underwriting. Knockout questions are generally broader and there are more of them. Gathering several years of medical and pharmacy data is inconvenient for clients, and it takes the carrier time to consideration, and at the end of the process leads to lower acceptance rates. Easier claim qualification. I'd mentioned that Home Care Secure requires that either a physician, registered nurse, or licensed social worker certify that the individual cannot perform 2 or more of the ADLs or suffers from a cognitive impairment. Other products on the market use medical necessity, and that's a standard that can only be attested to by a physician, is more subjective in nature, and represents a higher standard for clients to meet. And then finally, the availability of the Aging Home Association. We established earlier in the presentation that these policies will be enforced for 5 to 15 years or more before the cash benefit's needed. But with Home Care Secure, membership in the association provides immediate and ongoing value to your clients with its free and limited telehealth visits and all of the other discounts and services that Liz described, including care coordination through Wealthy. So as you compare annual premiums, factor into the equation that the association can deliver to your clients up to several $100s of cost avoidance each year, which is effectively a direct reduction in premium costs. Finally, we believe that these immediate and ongoing benefits of the association will serve to increase policy persistency and keep those renewal commissions coming. So the next 3 slides, which I'll cover in 5 minutes or so, provide a perspective on the addressable market in the United States and that segment of the addressable market that we think is appropriate for Home Care Secure. Talk a little bit about buyer characteristics, and then leave you with some use cases. And hopefully, all of this will help you in your as you formulate your marketing campaigns. So first, from an addressable market perspective, the headline here is that there are 120 million households in the United States, and 50 to 55 million of them would benefit from Home Care Secure. So let me orient you to this slide. So this slide illustrates the number of households in the US by age, employment status, and investable assets. Each block represents 100,000 households. The blue blocks are actively employed individuals who are under the age of 55. Green blocks are actively employed individuals age 55 and older, and the yellow blocks are individuals who are retired. Households are grouped into 6 investable asset categories. You can see the category names and the amounts that they're associated with on the bottom of the slide. And they range from low net worth individuals, defined as those with assets of less than 100,000 on the left-hand side, to the mega millionaires with assets of 3.5 million or more on the far right-hand side. And the red dotted box represents our perspective on the households and individuals who would most benefit from Home Care Secure. And it's essentially the upper quartile of low net worth, extending to the lowest quartile of high net worth. And you might ask yourself, well, why isn't it everyone? Well, on the lower end of low net worth, there are premium affordability issues. And then those on the upper end of high net worth and mega millionaires can fund the cost of home healthcare services out of their personal savings. It's that group in the middle, which, again, is a 50 to 55 million households that could most benefit from Home Care Secure. So let's talk a little bit about the target buyer characteristics. So individuals will purchase Home Care Secure for a variety of reasons, including life stage, financial considerations, and personal experiences and lifestyle expectations. But it's important to keep in mind that these are not silos, and individuals can possess characteristics in multiple areas. So let me just go through a quick representative sample. From a life stage perspective, individuals in their 40s likely have experienced a loved one, for example, a grandparent or a parent, go through a physical or cognitive decline, and that's a very powerful motivator in their minds. Individuals age 50 through 65 are beginning to think about and plan for retirement and what that might look like. finally, individuals age 65 and older are considering care options, as they age. From a financial perspective, we just saw on the previous slide that 87 million households have investable assets of less than $100,000. And Liz shared with us earlier that the average person will consume $50,000 of unreimbursed custodial home health care expenses in their lifetime. Thus, for the vast majority of Americans, retirement savings are insufficient to cover custodial home health care needs. So educating them on this potential gap in their financial plan and providing them with a cost-effective solution is the right thing to do for your clients. And then finally, from a lifestyle expectation perspective, we all have a strong desire to independently, both physically and financially, age at home. This has always been a strong motivator, but even more so in this pandemic environment. So let's take a quick peek at some use cases. So I'll start on the left. So Medicare, this is a natural one. Let me take the scenario when an individual is aging into Medicare. And by the way, roughly 10,000 individuals age into Medicare in the United States each day. And chances are high, quite high, that the individual's monthly financial obligation for Medicare will be lower and potentially substantially lower, especially if they're transitioning to a Medicare Advantage plan, than their employer-sponsored healthcare was. So that's a great opportunity to educate your clients on the potential financial exposure to custodial home healthcare expenses and redirect some of the premium savings that they've experienced to fill the gap with the Home Care Secure policy. Looking at ACA individuals, leveraging the power of the American Recovery Act. So the American Recovery Act increased the premium and plan design subsidies for individuals at or below 400% of the federal poverty level. In addition, it introduced for the first time subsidies for select individuals who earn in excess of 400% of the federal poverty level. And so the rationale here is the same as those aging into Medicare. An opportunity to educate your clients on the potential financial exposure and redirect some of the premium savings they're experiencing to fill the gap with Home Care Secure. And then finally, for those of you on the phone that are in the or have some clients in the group market, some employers, if you read the literature and speak with voluntary benefit platforms, you will learn that the next big thing in voluntary benefits is quote unquote caregiver benefits. Just some quick facts. 45% of employees have caregiver responsibilities. The annual cost to employers for full-time employees with caregiving responsibilities is in excess of $17 billion. That works out to over $2,400 per full-time employee. So is a significant financial impact on employers. So Home Care Secure is a voluntary worksite benefit that benefits everyone. So if you're the employer, not only are you now offering a valuable caregiver benefit, it's not a burdensome offering. Home Care Secure is not an ERISA plan, so there's no 5500s, no summary annual report or discrimination testing, no minimum participation requirements, and because premiums are paid with bank draft, no payroll deductions to worry about, and no one to notify, if and when the employee should terminate. From the employee perspective, it's a fully portable benefit that fills a significant need in my financial planning. And then from all of your perspectives, each employee represents potentially multiple sales opportunities when you consider not only the employee, but their spouse and potentially parents and in-laws as well. So let's now, just a couple minutes before we get into Q&A, just kind of recap the opportunity. So why introduce your clients to Home Care Secure? So there's opportunities for your clients and for each of you. Each of you are trusted business advisors to your clients. And here's an opportunity to reinforce that position by educating them on a potential gap in their financial plan and introducing them to a solution to protect their future and provide them with peace of mind. We realize that your time is your most precious resource. Thus, we designed Home Care Secure to be easy for your clients to understand, affordable, experience high acceptance rates, and save time with an efficient enrollment process that takes 15 minutes or less to complete. So finally, agent resources and support. So all of us here at Home Care Genie, Premier and Guaranteed Trust Life are laser focused on your success. We've developed a number of client-facing materials, such as an explainer video, a 2 or 3 minute version of that explainer video that's approved for consumer use. product brochure, customizable postcards, and other assets to assist your marketing efforts. We're fully leveraging Guarantee Trust Life's technology platform, including eApp, which is their online quoting and enrollment tool, and GT Link, which is their agent portal. And finally, as you introduce home care secure to your clients, we look forward to your suggestions as to how we may best serve you. So what's next? So if you're already contracted and appointed with GTL, congratulations, you're ready to start selling home care secure. If you're not, please feel free to reach out to Katie, and her contact information is on the screen, and she and her team would love to work with you to get you contracted in the market as quickly as possible. So with that, that concludes our formal remarks, and we thank you for your participation, and I'll turn it back over to Mandy to moderate the Q&A session.
Okay, so I actually only have a couple of questions, but we're going to still go through them anyways. First one was state availability. They noticed that we only have a handful of states so far. So I think you had a slide on there, Nick. So any plans? Oh yeah, you got it, the map out here. So, and Nick kind of answers their question. We can also, for those attending, we can also send you a state availability chart. It'll just does this one as well, so that way you have it on hand. I know we have a lot of agents who do sell in several states, so thanks for putting that back up there, Nick.
Sure. Yeah,
also, my other question, I had two people ask it, was about the vesting part of it, or the grading kind of. Would you be able to go over that one more time with them quickly?
Yeah, absolutely. So yeah, we have two slides here that I think would be helpful. Let's do, yeah, this one here. Okay, so this is an example of someone who purchased a $50,000 lifetime maximum benefit, and so the first column here is just policy year 1, policy year 2, and so forth. And a policy year is unique to each individual. It begins the moment the policy is issued and ends 365 days later. So the available maximum is limited in the first 5 years. So for example, any loss that began in the first policy year, and by the way, there's no waiting period. So the loss literally could have occurred 2 minutes after the policy was issued. But it's but your access is to 10% of the $40,000 or $4,000. On the first day of the second policy year, the available maximum increases to 20%, which is $8,000. Now I'm kind of toggling between the second and the third column. The third year it's 40%, goes up to 16, which is 16,000, 40% of 40,000. And then you can see beginning in the sixth year, it reaches $40,000, and that's where it will remain for the individual who didn't purchase the inflation protection rider, and we're putting the assumption that they didn't do a buy-up. And if you look at the right column with the inflation rider, beginning in the 7th year, the 3% simple interest would increase the maximum by $1,200, which is 3% of $40,000. Now, I want to show you another slide because I want to illustrate how the slide with the 3 claims and how those. So here's an example of an individual purchased a policy and had 3 claims over a 6-year period. The first 2 claims occurred during the grading period, and the third claim, the final claim, occurred when the benefit was fully graded. And just to show you how it works, and really the claim, the way the plan is structured, it's really to for the it has the insured's best interest in heart, the way it was designed and structured. But the rules are up on the top. So basically the rule is determine the available lifetime maximum benefit, not taking into consideration what's been paid to date. Divide that figure by 50, and that's the weekly payment for that particular episode of care. And then you would pay that amount up to the policy lifetime maximum benefit or recovery for if that were the case. So let me take you through a quick example. So this is a person with a $50,000 lifetime maximum benefit. So they had a claim in the first year. Well, what's available to them? Well, it's 10% of the $50,000 or $5,000. That's intended to pay over a 50-week period. So that's 5,000 divided by 50 is $100. For the sake of this example, this claim went on for 25 weeks, so the insured received $2,500, $100 a week for 25 weeks. They recover. 2 years later, they suffer another loss. Okay, what are they entitled to? Well, in year 3, the benefit's 40% graded, so they have $20,000 available to them, 40% of the $50,000. Notice that we didn't reduce the $20,000 by the $2,500 that was paid from the previous claim. We don't adjust for any previously paid dollars. So $20,000 is available to them. Paid over 50 weeks is $400. In this example, the length of claim was 30 weeks, so $12,000 was paid for this episode of care. Collectively, between claim 1 and claim 2, $14,500 has been paid. Final claim in year 6. Well, in year 6, the benefit's fully graded, so the individual has the full $50,000 available to them. Over a 50-week period, that's $1,000. This particular claim was it was a 40-week claim, but in practice, what would happen is for the first 35 weeks, the individual would receive a $1,000 payment. In the 36th week, they would get a $500 payment, and then benefits would cease because they will have exhausted the $50,000 lifetime maximum benefit. So I hope those 2 slides helped crystallize for all of you the how the grading period works and how it works in practice when should someone have a claim during or after the grading period. But if there are more questions, happy to take them.
Yeah, thanks, Nick. And then I think last one, can we talk about or go back over some of the benefits of that aging at home association that's involved with the home care secure product?
Sure. Are there particular aspects of the program that you're more interested in, or?
I think just kind of they're asking. Sorry, I had a client of mine email me this question actually. Just kind of an overview of just the benefits that you've kind of posted here. I think that's kind of a new concept for people involved with the product, especially agents that we work with other carriers too. This is kind of a new thing for them to talk about. So just kind of an overview of some of the big benefits or ones that you feel are kind of the driving selling force of that aging at home association.
Sure thing, and this is Liz. I can highlight that. So the ones in particular, and kind of when I was going through the section that we highlighted, these benefits with the association, they're not only available to the insured, but also their immediate family members. So the one in particular, the unlimited telehealth visits with MD Live, so that is for the individual, and any family member can have free unlimited virtual visits within the comfort of their own home. So I know in particular right now, telemedicine, especially during COVID, right, became very popular because individuals, if they weren't feeling well, didn't necessarily want to be in a physician's office. And so telemedicine became extremely popular because individuals could have a visit directly there with the physician through their phone or their iPad, their tablet, their computer, right? And while we like to highlight, while a virtual visit should not be a replacement for your in-person visit with your PCP, but we think that it's a lovely complement to it, especially during these very challenging times when people are hesitant to be close to other individuals, especially when they're not feeling well. In addition, we also offer discounts on vision and dental. And so what we like to highlight with this is that it is up to 50% discounts when you're using a number of these participating providers. And it counts for, so for vision, you would get discounts on your eye exam, your eyeglasses and frames, and contact lenses, in addition to your annual eye exam when you go to do that. Similarly for dental, if you would go every 6 months for your 6-month checkup, you would have discounts of up to 50% on your cleanings, on your x-rays, and then should you have to have any type of procedure, say if you need to have a root canal or you have to have a filling, or maybe you need work done to do a replacement on a tooth, those services can have discounts of up to 50%. So when we highlight that you can have on average $500 a year in savings, we were very, very conservative in those estimates because you can see how with vision and dental alone and the unlimited telehealth, those benefits can add up very quickly. And that average of $500 a year did not even include some of the elements that come through with the prescription drugs. And one of the things we've highlighted that certain brand name drugs, you can experience discounts of up to 85% off of those, leveraging your prescription drug benefit through the association. So I'll pause there for a moment to see if that answered the question or if there's anything else in detail that you would like.
Actually, I had some more questions coming in on the discounts, the dental specifically, but that was before you just overviewed it. So I think that answered that portion. The other question that came in is about the discounts and the resources for aging at home. Are these in addition to any insurance plan they may have?
So it is for the prescription one in particular, you cannot use that in conjunction with another prescription drug plan that you have. But what we like to recommend is you can easily go online and you can type in your prescription drug name, type in the dosage and the frequency with how often you take it, and then you can compare what you would pay through our service versus what you would receive through the other. And then based upon that, and mind you, this will differentiate between drugs, right? So just because one drug may be more beneficial than another depending on your plan, it's always very advantageous, I think, for you to check every prescription that an individual would be on, and then you can do that comparison. And with the network that they have, in particular, when I have done it, I had an option. I was able to choose between 8 different pharmacies within a 5-mile radius that had offerings that were better than what I was currently paying for a prescription. And so we highly recommend that you utilize it. It's a very intuitive, easy to access tool, and you can type in those basic information and then see which prescription drug coverage would give you the better benefit. And again, it will vary by drug and by prescription, but that one in particular cannot be used in conjunction with another. Different things like the DME, that is something, because that's just a general cash discount, that based upon your payment, if you were to purchase something, you can get 10% off after a $100 spend. And then you could use that in conjunction with something else, especially when you have to pay for something out of pocket. When it goes through your normal coverage, then this would allow you to receive some discounts on those out-of-pocket expenses as well. So I hope that answered.
Sure.
Any other questions?
Yeah, I think that's it. Another one that came in is kind of referring back to the slides we were just on with Nick. Really just asking, is the multi-episode example that you provided, Nick, is that available for agents to review, or like to kind of have I suppose like a PDF of, or something that we can, of course, I mean, we can always reference our agents back to this webinar, but do we have any, or does Home Care Secure have any examples of this that would be like client friendly to use to help a client better understand how the vesting works?
Well,
and how this episode works. That makes sense.
No, yeah, totally does. Thank you. So I think, well, to what exists today is this slide, which, you know, hopefully, yeah, again, it kind of doesn't stand on its own. It requires a little bit of an explanation with it, and then we have a specimen policy, and it's outlined in there as well, although not as clearly as I think it's laid out here. So let us think about how we could you know, create an asset that would be helpful for all of you as you're, you know, explaining this concept to your clients.
Yeah, and as far as like agents who, as far as, you know, when Katie and I, or if they need a visual tool, kind of like this is providing, would it be okay if I showed them this slide referenced from you guys in order for just a tool for them?
Yes, absolutely.
Okay, perfect. Yeah, I can make sure our gal that asked that, I can make sure to get her this information on the slide. That way she's got something she can kind of reference back to, because it is kind of, some of our agents who are starting to look into this product know that's kind of a new concept for them as far as a product having that involved. So that'll be perfect. But other than that, that was the last questions on the product I got. So what I'm going to do is I'm going to draw our winner of our gift card today. So I actually pulled up a random number generator from Google on my phone. So I'm going to just have it generate the number, and that's going to be our winner today. I thought I'd get, work smarter, not harder here. Okay, so it's giving me a number. So today, our winner is, let me go back through and see, Miss Emma Siebert. So Emma, I know, has attended some of our webinars before, so I'm pretty sure I have her contact info. But Emma, if you would kindly in the question box just send me your email to confirm your contact information, and we will reach out to you about getting a price. We actually have a gift card for you and some GTL goodies that we have that we're going to send your way. So I'm going to pull the email from the presentation here, Emma, but also just confirm that that's the one you want us to reach out to you by, and we will get some things sent your way. But with that, Nick, Liz, thank you so much for coming today and joining us. We always enjoy having you here. We love that we have something awesome and new from GTL to talk to our clients about, and this is definitely one of our more unique products. It covers a bigger age range than a lot of our other short-term care offerings, so we love to have something like this on deck. So I thank you so much for coming and sharing it with us today, and I'm sure we'll have you back again to chat with more people again soon.
Terrific. Thank you, Mandy. Thank you, everyone. Have a great day.
Yeah, thanks so much. Enjoy the day.
Bye, everyone. Thank you so much for joining us, and we'll see you on our next one.
Bye-bye.